guys could at least motion for the camera. Okay, here we go. This is my speech, my informative speech on postpartum depression. Every year, 1 in 8 mothers suffer from postpartum depression. That equals to about 500,000 per year, and that's only the women that seek help and not the women that don't. Baby blues is a common form of depression that occurs the first 2 weeks a baby is born. It includes tiredness, anxiety, irritability, and that's very common. But when the baby blues don't disappear, that's when the postpartum depression starts. That's moderate to severe depression occurring anywhere up to a year of the baby's life, and most likely to occur in the first 3 months. Now that you know what the difference between the baby blues and postpartum depression is, we'll go through some of the causes, symptoms, and treatments for it. Causes for the postpartum depression is your hormones. When you're pregnant, your progesterone and estrogen increase way high, and after the baby's born, your hormones come crashing down, and it causes a big influx of depression. Any prior depression, whether it's just regular depression or postpartum blues, if you had it before, you're more likely to get it again. Any type of stress, whether it's financial, related to your job or your family, stress will increase it. Fatigue and lack of support from your family or your spouse, that increases it. Those are some of the causes. Let's look at some symptoms of it. Agitation is a symptom. You'll have change of appetite, loss of energy, crying, trouble sleeping, and then negative feelings towards the baby. Symptoms are treatable. Some of the treatments are antidepressants. A lot of the antidepressants out there you can still take while you're nursing, so you'll be able to still breastfeed your baby and take an antidepressant. There's psychotherapy, and including the psychotherapy, there's cognitive behavior therapy, which they try to reframe your mind to get your mind reframed around the baby and not about all the depression. There's interpersonal therapy, and that is your quality of your relationship with the baby and your family, trying to get the relationship better. And then there's couples therapy that will help remove any of the disagreements and everything that you may have with your spouse during raising your child. And for the last one, there's electroshock therapy, and that they do that with some sedation, where they'll sedate you and then they'll hit you with a little bit of electricity to try to knock out the depression. That's only in the most severe cases. For prevention, all you need to remember is to make sure you ask for help, get a good support system going, and if you have any of the symptoms or causes, especially the negative feelings towards the baby, make sure you call the doctor and make sure you get some help. Those are my symptoms and my causes and treatments of postpartum depression. I hope you all be able to recognize and identify the postpartum depression from now on and maybe be able to help somebody. Thank you.